Friends, in this presentation, we will briefly discuss ways to fully enjoy any festival or party day without the worry of blood sugar spiking. We all look forward to enjoying feasts during festivals or special occasions. Different types of dishes are typically associated with all these occasions, but in families with children living with type 1, there is often concern about blood sugar levels getting disrupted due to this special food on such occasions. Let's understand some essential specific rules to keep normal sugar level on such occasions, which are applicable in situations using both insulin injections and pumps. We will understand the rules related to special days in two parts: insulin dose information and food-related information. Don't worry, it's easy. Just understand the amount of extra carbs consumed and cover it with an appropriate extra dose of insulin. First, calculate the child's insulin to carb ratio, or ICR. We have discussed this in the perfect sugar as well. Add up all types of insulin doses required for the child throughout the day and divide 500 by this number. Remember that for young children, it is better to use the number 330 instead of 500, and this amount is to be given in addition to the daily dose. For children using injections, this amount should be given as short-acting insulin a little before meals, and for those using a pump, it should be given as a pre-meal bolus. When the amount of protein or fat in the food is high, as is often the case in feast meals, blood sugar may rise 5 to 6 hours after eating. In such cases, you can give up to 20% more dose according to the ICR. Many people have experienced that in such cases, using regular or premixed insulin injections instead of ultra-short-acting insulin and giving combination bolus instead of standard in the pump can keep sugar levels controlled for a longer time. Let's now understand food content-related facts. Let's find out the carb content of popular food items at children parties. To make it easy to understand, a standard serving size of the item has been taken. But be aware that different ingredients, size, cooking methods, or individual eating habits can significantly influence this information. So, along with the information provided here, it is also important to follow the information on food packets, labels, and the suggestions of your diabetes specialists and educators. One burger contains 60 to 65 grams of carbs, one slice of pizza, 30 to 35 grams, one samosa or kachori, 25 to 30 grams, a small cup of ice cream, 25 grams, one cup of cooked noodles, 45 to 50 grams, one piece of momo, 10 grams, one idli, 15 grams, vada, 25 grams, and dosa, 30 grams. One small piece of chocolate, 4 grams, one cream biscuit, 5 to 7 grams, small packet of chips, 15 grams, one glass of juice or cold drink, 20 to 30 grams, one paratha, 30 grams, one bowl of kheer, 40 grams, one bowl of dal, 15 grams, one bowl of vegetable or non-veggie gravy item, 5 to 10 grams. One piece of traditional sweet is 15 to 30 grams, and one pastry is 45 grams. Chicken biryani, 30 grams, small serving of French fries, 30 grams, pasta, 25 grams, sandwich, 30 grams, and candy floss contains 100% carbs. But remember that in all these items, the amount of cheese, ghee, oil adds extra fat, and adding paneer or non-vegetarian ingredients also affects the amount of protein. Now, let's see by applying this information with the help of an example. If a child receives a total of 25 units of insulin combining long-acting and short-acting, then the ICR is 500 divided by 25, which is 20. In simple terms, having an ICR of 20 means the child will need one additional unit of insulin to cover an extra 20 grams of carbs in the meal. Now, if this child wants to eat a burger and a cup of ice cream at a party, he will need 4 extra units of insulin for approximately 80 grams of extra carbs. Isn't that easy? Also, make sure to regularly monitor blood sugar on such days and provide corrective bolus if it gets too high, as explained in Perfect Sugar. On such days, Prepare light meals with a low glycemic index at home, like lentils with skins mixed with leafy vegetables, to balance the effect of additional dishes. By following this information, you will surely be able to enjoy your happy days. And to easily understand more topics related to type 1, such as diet, hypo, and sick day rules, you can watch more videos in the Type 1 Genius Academy playlist. Bye for now. Thanks for watching.